I'm Dr. Craig Anderson. Just want to tell you a little bit about the disc. We all heard this idea of the disc. There's a disc between the vertebrae in our spine. It supports us. It creates a cushion. It creates padding between the vertebrae. But the disc itself is quite a complex orchestration of chemicals. Some of them have different properties. Some of them have properties that are very elastic. Some are more stiff. And the combination of these two properties give us what we know as the disc. If you look at the disc, there's an inner part, which is the nucleus, and then there's an outer part, which is called the annulus. It's like a wicker basket. If you were to look at it under a microscope or just in person, you would see that there are these angles, these 30-degree angles of fibers that create this wicker effect. So the inner part is this jelly donut kind of thing. So the jelly on the inside create this rounding in the middle of the disc. This creates a pivot point for the disc movement. So if you bend to the right, you want that pivot point to be in the center around the disc, around the nucleus. Now what happens when you injure this disc is that nucleus gets squashed, it flattens, and then suddenly you don't have a pivot point anymore. And in order for function to happen, your muscles have to kick it up a little bit. They have to work harder because now you're opening and closing a door without a nice hinge. You have muscles that have to force the issue. So you end up with muscles that are constantly tight. So if you're someone, let's say you're over 35, and you just always know your lower back muscles are just always tight, and you may have this early disc problem. Now what's the solution for this? Well, when it's at the late stage, the solution is unfortunately often surgery. In the early stage, the solution is chiropractic care. Now, chiropractic care is the only profession that can address the specific segmental dysfunction of the spine. There's no other profession that can do that. Physical therapy, they don't address the specific movement of L5 on L4, for example. They work on the region. A lot of good things happen with physical therapy, and chiropractic and physical therapy working together is fantastic. We just want to keep you from surgery. So let me show you what it's like to adjust the lower back, for example. This obviously is not a patient, this is just a model, but we look at the different segments here. We want to make sure everything is working and moving properly. We assess it by challenging and having each vertebrae move to a certain range. And then if you look close here, when I flex the spine, the disc actually can shift backwards into the nerve. So we want to take that flexion out by extending the spine. We do that with an adjustment, and we can support this with exercise after the adjustment. But essentially the adjustment is put the patient on their side, and I roll their hip a little bit to cause this joint to open up a little bit, and then we induce that extension to help line up the lower back. It is a fantastic way to keep the spine healthy and to keep the spine mobile. So now you know a lot more about the disc. If you know someone, or if you yourself have some disc problems, or you have some tightness in your lower back and you just don't have the answer, you're going to want to make sure you see a chiropractor. Yeah. If you're in the St. Louis area, I would be happy to be of service. You can find my practice at craigandersondc.com. If you'd like a coupon and a discount because you've made it all the way through this video, you can simply text the 4 digits DISC, DISC, to the number on the screen. Thank you for your time, and I would encourage you to share this video with anyone that you think may be benefited by this. Thanks.